Hey everybody, Dr. Patel here. Welcome to this week's Facebook Live. Sorry for being late. I hope you all are doing well. Today we're going to be talking about shoulder pain exercises and what's good, what's bad, what are things that could be really helpful, and what are things that could actually make the situation worse. If you like this video or any of the stuff that we're putting on, please like, subscribe, share, and all that fun stuff. If you have things that you want me to talk about, then please contact us. You can comment, DM, or email us at info@fxregencenter.com. And if you missed any of our videos, they're all available on Facebook, on our YouTube channel, or on our website, which is fxregencenter.com. So without further ado, we're going to be talking about the shoulder. We have talked about the shoulder in the past. We've talked about the anatomy, but I'm going to briefly go over some of the anatomy today. I'm going to talk about some of the things that are common culprits in terms of causing shoulder pain. And then I'm going to talk a little bit about some of the exercises that we do normally that can actually cause irritation to the shoulder if it is injured, as well as the type of exercises we should be doing in order to try to take pressure off of the joint. So first and foremost, talking about the shoulder joint anatomy, just going to go through these 3D images. Really interesting company called Biodigital. I have no stakes in the company, but check it out. These models that they have are actually pretty cool, interactive models. This is an example of a right shoulder. When we look at this, this is the pec muscle in the front. This is your deltoid muscle, the big muscle of our shoulder that we typically think of when we think about the shoulder region. And then we have the muscles of the arm, right? The biceps in the front of the arm. We have the triceps towards the back of the upper arm. And then we have the shoulder blade here, which we can see here. And that shoulder blade has a bunch of muscles that are coming from it. And these are the muscles of the rotator cuff. And we'll go more into depth with this a little bit as we progress with this model. But when we strip away all of the layers here, we can actually go down to just the shoulder joint itself. We strip away these layers. Strip away some more layers here, and you can see that the shoulder joint is actually a ball and socket joint. And if you look sideways here, or I guess I should turn my head this way to orient you. If you look sideways, it's kind of like a ball on socket joint, kind of like a golf ball sitting on a tee. And if you can imagine a golf ball sitting on a tee, that tee does not have a lot of surface area. So we have a couple things that provide stability to that golf ball on the tee, one of which is the labrum, which is this soft tissue ring that surrounds the tee, basically provides more surface area and allows the ball of the socket to be more secure on the tee there. And we also have a thing called a capsule, which is soft tissue ligament type structure. Think of it as the consistency of a rubber band. That ligament type capsule surrounds the joints, and we have thickenings of that capsule, which are your ligaments, your true ligaments of the joint that provide stability there as well. And then on top of that, we then have our rotator cuff muscles. So in the front, we have your subscapularis muscle. Oh, not yet. And let's see if I can get these rotator cuff muscles coming in. There we go. In the back, we have teres minor, infraspinatus, and supraspinatus. And you can see these muscles basically wrap around the ball and socket joint. And it's called a rotator cuff because you can see that all of these muscles are pretty much continuous, with the exception of this gap here, are pretty much continuous like the cuff of our sleeve. Now, when we talk about shoulder injuries, generally speaking, they fall into two broad categories. Things that involve the joints or things that involve the rotator cuff or other soft tissue structures. So when we talk about the joints, again, we're talking about the ball and socket joint being the main joint in the shoulder. But we're also talking about this joint up here between the collarbone and the tip of the shoulder blade. You see the shoulder blade actually comes to this tip right here, and that interfaces with the collarbone at what's called the AC joint, or acromioclavicular joint. The acromion is this tip of this shoulder. So one of the types of pain that occurs with shoulder pain would be pain on the very top of the shoulder, and that would potentially be the AC joint right there. That joint is one of the most common joints that develops arthritis. It is more common to develop arthritis or more in that joint rather than the main joint, which is the glenohumeral joint. And this joint very commonly develops arthritis in active individuals as well. And the most common example that we use for arthritis in this joint are people that are doing any sort of overhead activities, throwing athletes, as well as people that are weightlifting. Why is that? Because the collarbone and the tip of the shoulder are constantly kind of banging against each other with these type of activities. So over time, there's some wear and tear that takes place. Now, arthritis is, if you heard me say this before, arthritis does not necessarily equal pain, but this is something that can become painful if we're doing repetitive activity, and particularly if we're doing things with poor form. So one of the exercise categories of things to avoid when it comes to shoulder pain is if we can identify specific exercises that are causing pain in our shoulder. Well, right off the bat, those are things that we should avoid. This is not a situation when pain just comes and lasts for a day or two and then never comes back again. I'm not overly concerned. But if you have pain that's repeatedly occurring, particularly on the top of the shoulder, well, then we have to take a step back and say, all right, is there something we're doing that's causing that pain? So for the AC joint, for example, I've had patients that are doing a lot of overhead press or bench press that are constantly causing aggravation to that AC joint and causing pain. Or people that are doing things across their chest like this, which could again put pressure onto that AC joint. That's the type of situation. It's not a no pain, no gain scenario. This is something that we have to take a step back and take a break from those exercises. Now, as the AC joint develops some arthritis, the bone can get actually a little bit larger, and that can narrow the space that's traveling underneath the bone. So if you could imagine, if this bone is getting larger, the space underneath that bone is going to decrease. So as that space decreases, the stuff that sits underneath there will have less room. So as we look here, we're going to point out that the rotator cuff tendons, let's see here, hide that guy. There we go. So you can see that this rotator cuff tendon of the supraspinatus sits right underneath this AC joint, right? When you see this rotator cuff tendon sits right underneath this AC joint. So if this AC joint, this bone is starting to get a little larger, you can see how that can cause some impingement of the rotator cuff tendon, okay? That's an important thing to consider, because as we're getting a little bit older and we start to develop some arthritis, that joint itself might not necessarily be causing pain, but pressure onto that rotator cuff might be a piece of the picture, okay? So putting that rotator cuff aside for a second again and looking back to the other joints that may be involved, the main shoulder joint is the glenohumeral joint right here. Now, anyone that's an overhead athlete or anyone that has thrown anything in their lives at all can get an injury to the labrum. Now, a sudden injury to the labrum or a tear to that labrum can certainly cause pain, but there's plenty of people that have labral injuries, tears to the labrum or degenerative conditions with the labrum, and actually have no symptoms associated with it. Again, anybody that has overhead athletes, weightlifting, anything along those lines, anyone that's fallen onto their arm can have a tear in that labrum. And while that can cause pain, that does not necessarily cause pain, but what it can do is cause some instability of that ball and socket. So now all of a sudden this ball could be actually more mobile, there could be more shear that occurs inside this joint. And over time, the smooth surface of the bone called the cartilage can gradually wear away, and the bone can get a little rougher, which is called osteoarthritis. And again, towards the end stages, that itself can cause pain, but osteoarthritis does not necessarily equal pain. But if we have this scenario and we're not moving correctly, it's easier for the joint that has arthritis to become painful. And one of the things that we see is that if this labrum is a little bit loose and there's a little bit more instability in this joint, there are exercises that we do that can actually cause this bone to move too much. One of those exercises that can be done is actually exercises that are strengthening your deltoids. So the deltoids are the big muscles that kind of surround the whole shoulder. When we have that round muscle that we feel on our shoulder, the muscle that we most readily identify as involved in your shoulder joint is the deltoid. The deltoid actually has a few parts. It has the rear deltoid here, the lateral or side deltoid, and the anterior or front deltoid right here. And this is a multi-directional muscle. You can see it's a broad muscle with different parts. And this muscle is in charge of raising your arm to your side, raising your arm overhead. It's the front part of the deltoids are in charge of rotating your arms inwards. Your rear deltoids are in charge of bringing your arms out into external rotation. But overall, very strong muscle that starts at the edge or spine of the scapula and goes all the way down to the humerus or arm bone right here. Okay. One of the things that this big muscle does, because it does not actually attach onto the joint itself, but it goes over the joint area. What this muscle actually can do is pull that ball up from the socket. It can pull that bone up from the socket. So again, if you picture where that bone is, if that deltoid muscle is right here, when that contracts, it'll pull this ball up in its socket. So that could be something that causes excess shear inside that ball and socket joint. So if we have already developed some arthritis, then in some situations doing deltoid strengthening exercises like overhead press or butterflies or reverse butterflies could actually cause some extra shear of that ball and socket joint and cause some irritation there. But an interesting thing also is if we have a rotator cuff issue, so if the tendons of the rotator cuff are irritated, or if there's impingement or there's tearing of the rotator cuff, or if there's a bursitis or inflammation of the sac that surrounds the rotator cuff there, if the deltoid is strengthened, and this ball moves upwards, then it's going to effectively narrow the space between the AC joint and the head of the humerus. So I'm going to repeat that. If the ball moves upwards, it's going to narrow the space between these bones and the ball of the ball and socket. In narrowing that space, that can cause more impingement of the rotator cuff tendon. So one important exercise to avoid initially when we have an injury to our shoulder joint or rotator cuff one set of exercises to avoid are anything that involves strengthening your deltoids. This is something that is important. There are important exercises and that are certainly something that we should aim to return to. But when we have pain associated with the shoulder, initially it's important to actually avoid these exercises. Okay? Instead, what are the exercises that we should be focusing on? There are some exercises that we can do to actually strengthen some of the rotator cuff muscles directly. So there are some internal, external rotation exercises that could be done with bands that could strengthen the rotator cuff specifically. However, one of the main things that I typically recommend for patients that have shoulder conditions, especially rotator cuff impingement, but oftentimes across the board, are exercises strengthening the lats. So the lats are actually not in this diagram. But the lats are the muscles that are deep inside the shoulder and go all the way down to the flank. Let's see if I can find ourselves some lat pictures here. Da, 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 da. So we're going to look at the lats here. Let's see. Give me a second as I click through here real quick and get rid of all the stuff that I don't necessarily want to see here. And so we talk about the shoulder region here. The lats are actually these guys. These are big muscles that span all the way down from your low back region all the way to your sacrum towards your tailbone, your buttock area, and attach from the low to upper back and actually travel all the way up to the shoulder. Actually right below the shoulder, these muscles actually attach onto the humerus or the arm bone. So I'm going to get rid of these guys, and you can see where these guys attach here all the way up to this arm bone here. And these muscles, if you're familiar with any lat strengthening exercises, these muscles are actually in charge of anything that we're doing to pull down. So any of your lat bar exercises when you're sitting and you pull down on the bar, or pull-ups, right? Pull-ups when you're pulling yourself up, or chin-ups when you're pulling yourself up to the bar. These exercises engage the lats. Now, these are really important exercises when it comes to the shoulder, because what these exercises do, as opposed to the deltoid that is actually pulling the ball and socket upwards and then effectively pinching this supraspinatus tendon, right? Deltoid exercises pull this ball upwards, then pinching the supraspinatus tendon. Whoa. The latissimus dorsi muscles actually effectively pull this humerus down. Right? You can see that this muscle is down here, attaching here, pulling this ball down, which actually makes space for the supraspinatus or rotator cuff tendon. Really, really important for us to consider this. So one of the main exercises that I typically recommend to patients that have any kind of shoulder condition, but specifically rotator cuff conditions, are actually strengthening exercises of the lats. And there's a lot of different exercises that fall into that category. Things like using bands on the door, pulling those down, such as this. You could do that single arm, double arm, and pull down exercises like your lat pull down arms, like I mentioned, and pull-ups could be fantastic exercises. Now, we do have to be careful about things like pull-ups and lat pull downs. because if we're going too high up, then that can cause some pain or irritation to the shoulder as well. But if we're using something like a lat pull down and starting from this position and pulling down, that could be something really great to engage the lats initially as well. So why do I want to refrain from going all the way up in this position? Because when you go all the way up in that position, that can also narrow that space for the rotator cuff. And that goes into other things that we want to avoid. We want to avoid anything that we're actually rotating our arms inwards, our shoulders inwards like this. That internal rotation also narrows the space for the rotator cuff as well. So overall, generally speaking, we want to avoid any pushing exercises and move more towards pulling exercises. So overhead press, pushing, bench press, that also affects the anterior delts, right? We should try to avoid those initially and move more towards pull downs, right? Pulling for the lats. And also things like rows. Rows effectively can help strengthen things like your rhomboids, and especially if we are focusing on keeping our shoulders down when we're doing these rows, that can help with taking pressure off of the rotator cuff as well. So to recap, the things that we generally try to avoid initially when it comes to shoulder pain conditions, we try to avoid pushing exercises like strengthening the deltoids, so overhead press, chest press, or bench press, things along those lines. Butterflies or reverse butterflies, particularly butterflies. Reverse butterflies can help open up the chest a little bit and take some pressure off the rotator cuff as long as we're doing them correctly. And then the things to focus on are things like our lat pull downs, eventually getting up to things like pull-ups and chin-ups, things like rows, upright and seated rows to engage the rhomboids. That's all I got. That's the basic stuff. Now, obviously, there's a lot of details. There's a lot of nuances to this. And this is not medical advice, but this is kind of general information that could be beneficial for people that have shoulder conditions. For your specific condition, if we're not getting benefit from these little tutorials and various YouTube videos or whatnot, then it's important to make sure that you see a professional that can do an appropriate diagnosis, make sure they understand what's going on, and then send you to the appropriate person, be it a physical therapist or otherwise, to get you moving appropriately. And oftentimes with the appropriate strengthening exercises, the appropriate caution, we're able to actually get significant benefit to shoulder conditions without any interventions otherwise. And when interventions are necessary, there are a lot of great natural solutions that we have that can help strengthen your tendons, improve your joints, decrease inflammation, and prevent things from getting worse. I hope this was all beneficial for you. Again, if you have any questions, you feel free to comment, DM, or email us at info@fxregencenter.com. I just noticed, Peter, hi. Nice to see you. Thank you so much for joining. I hope this was helpful, and if by all means, I know a lot of folks out there are very, very knowledgeable and more knowledgeable than myself when it comes to this. So if you have some information that you want to share about other exercises that you found helpful or harmful, then please share with us, comment, and we can move forward from there. Doug Smith said, great video. Thanks, appreciate it. Thanks so much for joining in, and that's all I got today, guys. Hope you enjoyed. Next week, I think we're going to be shifting topics, and we're going to move on to something like the elbow. But I'll keep you guys posted. If you're interested in learning about what we have coming up, or if you have things that you want me to discuss, again, email us, info@fxregencenter.com. Like, subscribe, all that fun stuff. Wishing you all the best. Thank you so much, guys, and I'll see you next week.